For the Service Learning Experience project, I chose to volunteer at the Hampton Roads Salvation Army, which primarily consists of community outreach opportunities for volunteers to help decrease the level of food deprivations in the Hampton Road areas. Selected teams were given a multitude of responsibilities, retrieving food items, documentation, sorting, coordination, packaging, and delivery. Such teams were led by the volunteer coordinator, Shelby Hunt, an experienced event organizer. Each team was tasked with different departments for the food drive service to reach a common goal of serving community members, while specified professions took on responsibilities closely related to their employment background. I was given an opportunity to provide team members with more insight on public health entities and how to better serve communities through different services, alongside providing more efficient programs to supplement dietary needs. To answer the question, what makes a good collaborative service team for public health, I created a list based upon the characteristics that I seen in my team and how they correlated with public health. First on my list is diversity. The Salvation Army hires many individuals from various backgrounds, which helps to broaden the perceptions and insights of public health, including myself. And these individuals come from backgrounds including military personnel, community members from different age groups, individuals requiring community service hours, students, and just about any individual willing to contribute to the Salvation Army's objectives and goals. For a good collaboration team, diversity is an important component, considering a diverse team implements different perceptions. So when we were volunteering and doing the drive-through service, military personnel, for example, they were able to do more hands-on work, and they were great with organization and helping everybody stay in place. Next on my list is communication, which is one of the most important components of a good collaborative team. To complete set objectives and surpass desired goals, effective communication enabled a smoother process of serving community members. Communication helps team members share knowledge, provide feedback, build an adequate level of understanding, creates an environment for active listening, while sharing ideas on how to effectively allocate resources. Additionally, public health communication skills seeks to inform, educate, and empower populations, which is a reference that I use from our book. Leadership roles formally communicated with volunteer members to practice safety protocols to prevent the prevalence of foodborne illnesses and establish a healthy environment overall. So when the food donations came to the organization, volunteers that worked in the food department were required to wear hair nettings, gloves, wash their hands beforehand when handling food items, and the volunteer event organizer informed us of how to create a safer food environment for community members. Another keyword that I chose to select in creating a good collaborative team is key performance. In order to meet Salvation Army goals to improve the well-being of populations, team members must. Another component that I selected that makes a good collaborative team for public health is key performance. In my post, I stated In order to meet the salvation goals and to improve the well-being of the populations, team members must have prior knowledge on public health, including statistical data, community needs and surrounding areas, and programs to better serve communities. Alongside key performance, volunteers had to have a good work ethic for everything to run more smoothly and understand the goals and desires of the Salvation Army to serve communities and make sure that community members were meeting their dietary needs. Another component that I selected was leadership. Good collaborative teams require leadership in order to teach the importance of public health to populations, organizations, and institutions through the implementation of change. For example, military personnel establish an adequate amount of leadership by performing primarily handiwork and helping to organize the food items. Alongside, in addition to Shelby Hunt being a really good leader, and we had to introduce ourselves in the beginning of the volunteer hours to, get an idea of our background, to see where we would be placed. She was also good at the last component that I chose that makes a good collaborative team is time management and planning. Time management and planning is an important key factor in public health because allocating necessary resources at an essential point in time helps to ensure services and funding are utilized as efficiently as possible. For Salvation Army volunteer service teams, donations were delivered and packaged before food deliveries, in addition to volunteers maintaining the ability to use time management skills to service community members. To conclude the components that I listed, I would like to discuss the primary goals of the Salvation Armies for the service learning experience was to basically help household with meal disparities. As a contributor to the organization, I was given the opportunity to apply public health skills acquired from my educational journey in pursuing public health by discussing future programs with the event coordinator. So basically, I discussed with Shelby Hunt possible options for the Salvation Army in the future of serving communities better, which includes selecting communities that are primarily in need rather than serving clients that shows up at the organization that needs food items, and which could be more efficient because you can identify which individuals are more in need and the specify services that these individuals can utilize. Each team member serviced a unique purpose in the Salvation Army food delivery system. Altogether, we used a variety of skill sets to complete a multitude of objectives which required knowledge on basic public health competencies, but most importantly, a diverse team to help reach goals of serving a maximized number of community members.